Hello everybody, my name is Dr. Nitu Bajekal. I'm a consultant obstetrician and gynecologist based in London with over 35 years of clinical experience in women's health. My initial training, MBBS and MD Obs and Gynae, was in JIPMER, Puducherry and All India Institute of Medical Sciences in New Delhi. I must thank the team at Ahimsa for inviting me to do this talk. I'm looking forward to sharing the evidence on plant-based nutrition and lifestyle approaches in managing polycystic ovary syndrome, or PCOS as it's commonly known as. In women's health, there are issues that affect people assigned female at birth. I wish the term women to be used inclusively for anyone who identifies as a woman or has female reproductive organs irrespective of their gender. In this presentation, I will explain about polycystic ovary syndrome, or PCOS, the prevalence of the condition, symptoms and possible drivers. I'll be focusing on the role of plant-based nutrition, including lifestyle approaches, as well as the benefits of soya in managing PCOS. Although some women with PCOS will also need medications such as the pill, hormonal contraception, insulin sensitizing agents, and fertility treatment alongside. However, dietary and lifestyle modifications are key in the successful management of PCOS, both in the short term and to prevent longer term problems. PCOS is the single most common endocrine disorder worldwide affecting women of reproductive age. PCOS presents with a wide range of reproductive, metabolic, and psychological symptoms. PCOS often starts in the teenage years but does not usually get diagnosed until much later, if at all. The condition has repercussions which carry through well into the menopause. It's a complex, poorly understood condition that affects the way the ovaries function, and although hormonal imbalance is common in women with PCOS, it's not truly a gynecological condition. In fact, it's an endocrine condition. Polycystic ovary syndrome appears to be a highly inheritable disorder with multiple genes involved. PCOS is like type 2 diabetes with metabolic and environmental factors interacting to influence genetic factors. An exciting new research in a UK study of 175,000 men showed that the condition is not linked to ovaries for the first time, as men can also develop PCOS characteristics with risks of male pattern baldness, heart disease, and type 2 diabetes. So if there is somebody in the family with these features, they may well have increased risk of cholesterol and heart disease, and may have a sister or a mother with the condition of polycystic ovary syndrome. Let us now look at how common is this condition. We know it affects at least 1 in 10, but there are studies that suggest that as many as 1 in 4 women in certain subgroups may actually have the condition. 1 in 10 women of reproductive age, depending on how hard we look for it, but the worrying concern is that up to 3/4 of women with PCOS remain undiagnosed. Presentation varies by ethnicity, with South Asians, including Indians, being at higher risk based on studies done in India, as well as in indigenous Australians, Hispanic, and African Americans compared to the white Americans, for example. Also, those in high-risk populations, such as those with infertility or excess weight, prevalence and complications of polycystic ovary syndrome appear to be higher. So what are the possible drivers of PCOS? I must apologize that this slide is a bit more heavy on the science information, but stick with me. Polycystic ovary syndrome is affected by lifestyle factors and diet, which in turn influence body weight, insulin resistance, inflammation, oxidative stress, and androgen activity. The true cause of PCOS is unknown, but think of polycystic ovary syndrome as a close cousin of type 2 diabetes. And insulin resistance appears to be the main driver in 50 to 70% of PCOS. High levels of insulin stimulate the ovaries directly to produce androgens. The most common that you know of is testosterone. And insulin also indirectly suppresses the production of a protein by the liver known as sex hormone binding globulin, or SHBG, thereby increasing levels of free testosterone, causing signs of androgen excess. Increased levels of insulin is also responsible for many of the other symptoms of PCOS. Half the women with PCOS and those carrying excess weight are diagnosed with type 2 diabetes by age 40, which is a real concern. Yet in others, just carrying excess weight and being overweight may be the main driver by increasing estrogen production from the increased intracellular fat, causing a small sustained rise in the hormone, luteinizing hormone, which is produced by the brain, which then causes androgen levels to increase and back up and suppresses release of eggs or ovulation through a negative feedback loop. So it's not really clearly understood whether excess weight causes PCOS or whether it is vice versa. And even a third of those who don't have excess weight, known as lean PCOS, have increased intra-abdominal fat. And in some others, local androgen sensitivity increases in the hair follicles, causing excess cystic acne as well as excess facial hair growth, for example, which are androgen excess symptoms. Even when weight loss is not an issue, one-third of lean PCOS, which form 2 out of 10 of those with polycystic ovary syndrome, have increased abdominal fat on CT and MRI scans in research studies. So looking at excess weight, we do realize that making a change in this area can make a significant difference to improving the symptoms of polycystic ovary syndrome. Many of you who have heard about polycystic ovary syndrome may know some of these well-known symptoms. Menstrual irregularities are the most common sign of PCOS, which means infrequent periods or missed periods, medically known as oligomenorrhea or amenorrhea. Signs of androgen excess, such as excessive facial and body hair, adult and often cystic painful acne on the chin or on the chest, female pattern scalp hair loss, excess weight gain are just some of the common symptoms of PCOS, and as is insulin resistance. What is also important to remember is that PCOS is the most common cause of infertility in women. And this is because of the failure to release eggs regularly, causing infrequent periods or missed periods, known as anovulatory infertility. Let us look at some of the lesser well-known symptoms of PCOS. Disordered eating often goes unrecognized, especially as those with PCOS may be overweight or obese and carrying excess weight. So eating disorders, especially binge eating disorders without purging, seem to be more common in those with PCOS. Body image issues and even sleep disturbances, including excessive daytime sleepiness, snoring, and sleep apnea where your sleeping stops and starts, are just some of the less recognized symptoms of PCOS. One may also notice darkening of the skin, especially under the arms, back of the neck, known as acanthosis nigricans. Psychological issues such as obsessive compulsive disorder, anxiety, and depression are now recognized symptoms of this condition. Pregnancy-related complications also tend to be more common in those with PCOS, as well as miscarriage, pregnancy-induced diabetes known as gestational diabetes, and adverse pregnancy outcomes with bigger babies and more complicated deliveries. Unfortunately, there are metabolic consequences in those with PCOS which can last well beyond the menopause, although the condition itself often starts in the teenage years. Menopause itself may be delayed by 2 years, and androgen levels can continue to remain raised in the menopausal age. There are increased risks of type 2 diabetes, metabolic syndrome with raised cholesterol, abnormal triglycerides, and also an increased risk of endometrial or womb cancer and an increased risk of heart disease, especially if one is carrying excess weight. Half of those with PCOS with excess weight will be diagnosed with type 2 diabetes by the age of 40. Interestingly, a huge study from the UK also suggested that a significantly increased risk of COVID-19 was associated with PCOS independent of other associated risk factors. Womb hyperplasia or endometrial hyperplasia and endometrial cancer in women with PCOS under the age of 35 who are at risk from prolonged exposure without having periods to unopposed estrogen and long periods of amenorrhea is a real risk. Hence, hormonal contraception or progesterone that is used cyclically may be indicated in this group. It is really important to seek help if you're missing periods for more than 2 or 3 months at any time, unless there is a very clear reason, for example, pregnancy. Weight loss often causes resumption of cycles, so that is why doctors will recommend weight loss, but it needs to be done in a structured way and in a non-judgmental way. The risk of ovarian and breast cancer does not appear to be significantly increased in the presence of PCOS. A diagnosis of PCOS in adults is based on the 2003 Rotterdam PCOS criteria, involving a detailed clinical history, biochemical tests, and a pelvic ultrasound scan. Correct interpretation of symptoms and tests is really important to prevent both underdiagnosis and overdiagnosis of PCOS. Any two of the following three criteria must be met to diagnose adult PCOS. Oligo and or anovulation, which means not producing eggs on a regular basis, is one of the criteria. Hyperandrogenism, which is excess amounts of androgens, clinical symptoms either as a result of these increased androgens or abnormal blood tests or biochemical lab tests. The third criterion is polycystic ovarian morphology that follows a particular set criteria on ultrasound scan. Number of follicles and ovarian volume are taken into account. So any two out of these three must be met to diagnose adult PCOS. A single diagnostic criterion, such as androgen excess or polycystic changes on the ovary, is not sufficient for an accurate diagnosis of PCOS. And more importantly, for teenage PCOS or adolescent PCOS, ultrasound must not be used to diagnose PCOS because multicystic ovaries can mimic the appearance of PCOS or polycystic appearance of ovaries. PCOS is also a diagnosis of exclusion, which means other more uncommon or serious conditions should be ruled out, such as non-classic or late-onset congenital adrenal hyperplasia, as well as Cushing syndrome and androgen-secreting tumors before making a diagnosis of PCOS. Also, I must highlight that classification of PCOS that is done by some clinicians currently into different phenotypes is not recommended, and nor is it helpful at this point of time except for research purposes. Polycystic ovary syndrome is also an unfortunate name as there are no cysts in the ovaries. Instead, there are immature ovarian follicles that don't reach maturity and do not cause pain. Is there a difference between PCOS and PCOD, which is polycystic ovarian disease? It's actually the same. It's one and the same. Disease is not an appropriate term because there is no single cause for the condition, and so that is why we use the term syndrome, polycystic ovary syndrome. Androgens, the most famous of which is testosterone, also should not be called a male hormone, as these are found both in men and women in differing amounts at different stages of our lives. In fact, estrogens are generated mainly by the action of aromatase, which converts testosterone to estradiol. And so it is important to understand that estrogen cannot be present in the body without testosterone. And testosterone should not be called a male hormone, which then makes the condition of PCOS even more stigmatizing. There is no aspect of women's health that does not benefit from dietary and lifestyle changes. This is true for women at all ages and stages in their lives, including during pregnancy and menopause. Women will benefit from adopting a fiber-rich, plant-predominant way of eating and adopting lifestyle changes even when conventional medicine, Western medicine, or surgical approaches are necessary. It does not have to be one or the other. I will be focusing on polycystic ovary syndrome in this presentation, but there are of course several other women's health conditions such as endometriosis, breast cancer, painful periods, and chronic lifestyle diseases that affect both men and women, which will all benefit from eating in this plant-forward way. Changing the mindset and making health the goal rather than weight loss the goal is an important strategy so that we can advise this and encourage it in our patients to get a successful outcome. Lifestyle management along with changing behavior is recommended by all expert groups as the first line of treatment to prevent, manage, and treat the condition of PCOS and its long-term effects. Polycystic ovary syndrome is not a curable condition. However, we can get control over it by using lifestyle approaches and living PCOS free. Lifestyle medicine is the use of scientific, evidence-based therapeutic approaches to prevent, manage, treat, and in some situations reverse chronic lifestyle conditions. The same principles can be applied in polycystic ovary syndrome, and there are 6 pillars that I want you to focus on. The first is eating or following a predominantly whole food plant-based diet. Regular physical activity is the second pillar. Restorative sleep, stress management, avoidance of risky substances, and building meaningful social networks are other pillars that we should be focusing on if we want to manage polycystic ovary syndrome successfully. I'll be talking a little bit in some detail in relationship to PCOS. Let us now look at the first lifestyle pillar. This is following a predominantly whole food plant-based way of eating. By encouraging a whole food plant-based diet and recommending an intake of a variety of plant foods can be particularly beneficial in PCOS. So what should we be eating? Plenty of fruit, plenty of vegetables, intact or minimally processed whole grains, legumes, soya, herbs, spices, nuts and seeds should be consumed regularly because they are rich in fiber, and fiber is really important for hormonal health. Water should be the drink of choice. Just as foods we fill our plates with, there are foods that don't bring anything to the table. It is so easy for our palates to get used to highly fatty, sugary and salty, ultra-processed foods which then behave like hormone disruptors, whether it is chemicals added to these junk foods or it is the persistent organic pollutants, the mammalian estrogen, antibiotics, insulin growth factor and growth hormone that is present in all meats and in dairy. Essentially, all these foods, when eaten as regularly as they are on a modern diet, wreak havoc on the body, including our female and male reproductive systems. Let us now look at some of the benefits of enjoying a fiber-rich plant-based diet for PCOS. A fiber-rich diet, and fiber, remember, is only found in plants, not in any animal foods. A fiber-rich diet will help to promote healthy gut bacteria, lowers inflammatory markers, encourages the excretion of excess circulating estrogen, improves our cholesterol levels, and normalizes blood sugars. By reducing insulin resistance, the androgen and testosterone levels are lowered, so women often will say that there's an improvement in cystic acne, and they will also notice that there's an improvement in facial and body hair growth. A whole food plant-based diet that is rich in fiber will help the symptoms of PCOS, as was shown in a case control study looking at dietary carbohydrate consumption. The study suggested that the more refined carbohydrate diets that one eats, which means cakes and biscuits and samosas, they definitely are associated with PCOS. Fiber is, on the other hand, very beneficial. So when you have legumes, beans, dals, whole grains, fruits and vegetables, nuts and seeds, this really helps the gut microbiome as well as improves the symptoms of polycystic ovary syndrome. So these are carbohydrates, but they are not refined and ultra processed like the standard modern diet is. They also found that when we advise women to have a fiber-rich diet with PCOS, whether you need to lose weight or not, there is benefit seen in all the symptoms of polycystic ovary syndrome. I'm not going to spend too much time on this slide, but I do want to highlight advanced glycation end products that are found in so many foods that are responsible for accelerating the aging process. These are known as glycotoxins, and they react with proteins together to cause tissue stiffness, insulin resistance, damaging our ovaries and causing inflammation all over the body. Those who have PCOS seem to have even higher levels of advanced glycation end product receptors in the ovaries, making the ovaries particularly sensitive to damage by the effects of these advanced glycation end products. And this is not just found in those who are carrying excess weight. Even those with lean PCOS seem to have higher levels of these receptors. So it is really sensible to eat diets that are low in advanced glycation end products so it can reduce inflammation and insulin resistance. And so what are some of the examples of low AGE foods? Those are a whole food plant-based diet ingredients such as whole grains, legumes, vegetables, mushrooms, and fruits. While high AGE foods are meat, chicken, cheese, butter, cream cheese, and ultra-processed and processed snack foods, crisps and chips, and lots of other Indian fried savories and sweets. Cigarette smoking also increases harmful glycotoxins. So dietary advanced glycation end products can be decreased by changing the method of cooking from high temperature dry cooking to low heat and steaming and boiling methods rather than frying and barbecuing. And we found that in many studies, when you modify the amount of dietary advanced glycation end products in your diet by cutting out those foods that I mentioned and increasing whole grains and legumes and fruits and vegetables, it was found that women with polycystic ovary syndrome saw a significant improvement in their metabolic and oxidative stress health, just as they would in those with type 2 diabetes. I want to now talk a little bit about phytoestrogens and the role of soya in polycystic ovary syndrome and in general hormonal health. There's a lot of misinformation about soy, and so I do want to talk a little bit about this. Phytoestrogens are plant substances that have weak but very similar effects to estrogens in some tissues and blocking effects in others. This makes it very special, so it has many benefits, for example, reducing the risk of breast cancer while improving bone strength and normalizing hormone levels in polycystic ovary syndrome. The most important groups that you may have heard of are called isoflavones and lignans. Isoflavones tend to be found in soybeans, chickpeas, kidney beans, rajma, all kinds of beans, fruits, vegetables, as well as nuts like pistachios. Lignans, on the other hand, are entrolactone and entrodiol, and these are found in flax seeds, which are best taken in the powdered form, whole cereals, many fruits, and cereal bran. So phytoestrogens or plant estrogens are not found just in soya, but they're also found in many other very healthy, nutritious plant foods. I want you to listen to this slide very carefully. Soya is safe and good for women and for men, and is particularly good in polycystic ovary syndrome. Soya is not just safe, but has a positive role and should be included regularly in all diets at all stages and ages of one's life, unless one is allergic. Only 3 or 4 people out of 1,000 are allergic, compared to 3 out of 100 are allergic to dairy. Hundreds of scientific studies, over 30 years of rigorous research on soya, and more than 2,000 peer-reviewed articles are published every year and have confirmed the safety of soy. Soya has been shown to improve PCOS symptoms and metabolic markers in many studies. Eating a varied diet with regular soya intake has been shown to lead to weight loss, a slimmer waist, insulin reduction, insulin resistance improvement, blood sugar normalization, and lowering of cholesterol and triglyceride levels. It also helps counteract hormone disruption, but should not be considered as an endocrine disruptor. Neither soy intake or isoflavone exposure affects the hormone levels in men or women, so it can be safely eaten by all ages and all stages. Soya should be understood to protect against womb cancer, which is a long-term risk factor in PCOS of those who are excess weight. There's also a significant improvement and reduction in the risk of other cancers such as bowel cancer, lung cancer, prostate cancer, and ovarian cancer. And remember that most of the soya that is produced all around the world and is responsible for rainforest destruction and destruction of forests even in India is grown for animal feeds. Only 6% of the soya that we eat is found in mostly the Asian countries, is not genetically modified, and is also not responsible for the destruction of forests, because the amount of soya that is fed to animals is a huge, large amount compared to what a human would eat. Experts all over the world will agree that weight loss through lifestyle changes should be the first line of treatment, which means use of diet, exercise, and changing behavior, and it can help with all symptoms of polycystic ovary syndrome. Lifestyle changes can also help to reduce insulin resistance, which is the main driver of PCOS in 50 to 70% of cases, and can restore hormonal balance. Also, even a modest weight loss may result in a return of normal menstrual cycles and improve pregnancy rates. But weight loss advice should be given in a non-judgmental, supportive way, especially in the presence of disordered eating, which can be present in PCOS, but the doctor may not realize as they may be living in a larger body. It is possible, as per some studies, to achieve full recovery and reverse polycystic ovary syndrome, but it is really important to remember that if one returns to one's previous lifestyle of sleeping poorly or having stress or eating the foods that do not bring health and nourishment, then the condition can return. It's also important to remember that the use of insulin sensitizing agents, including metformin, is not recommended routinely in polycystic ovary syndrome. And the first line of management should always be the help of bringing lifestyle changes. Weight loss can be achieved by several methods. However, they're usually not sustainable, and while no one diet has been proven to be completely the only diet to be used in polycystic ovary syndrome, it makes sense to recommend a plant-based diet as it works very well, we know, with its close cousin type 2 diabetes. Most women tend to put weight back on within a few years, so a sustainable lifestyle change and a sustainable diet that does not resort to calorie restriction is helpful in managing PCOS long term. This is especially important because of the most serious longer-term metabolic consequences of polycystic ovary syndrome, such as type 2 diabetes and womb cancer and heart disease. Since we know that insulin resistance is the main driver behind polycystic ovary syndrome, where our tissues do not respond as well to the secretion of insulin as it does in those who don't have the condition, and in the absence of clear-cut evidence and guidance for a particular diet strategy, it makes sense to focus on a predominantly whole food plant-based anti-inflammatory way of eating, whether one wants to lose weight or not. This way of eating is rich in fruit, lots of vegetables, especially green leafy vegetables, beans, lentils and dals, herbs and spices, nuts and seeds, and soya, as well as mushrooms. All these can help to achieve sustainable long-term weight loss wherever it's needed. Otherwise, it can help to maintain hormonal health in all, whether weight loss is needed or not. I always recommend aiming for between 2 to 4 portions of minimally processed soya, one portion being 80 grams or a handful, so 80 grams of tofu or tempeh or a cup of soy milk or soybean curry or edamame beans, and also including complex starchy foods such as sweet potatoes, boiled potatoes that have been kept in the fridge and reheated to improve the resistant starch, and eating it with the skin as far as possible are excellent for PCOS as they cause slow release of blood sugars, maintaining the blood sugar levels rather than increasing them when one eats refined carbohydrate foods such as cakes and biscuits and white rice and white bread, and even brown bread, which often has very little fiber in India. Water should remain the beverage of choice. There are no dearth of foods that one can enjoy. In fact, on a whole food plant-based diet, you can enjoy so many traditional cuisines and also find that this is a joyous way of eating with an abundance of choice and no deprivation. You can see that instead of having paneer, you can have tofu palak, you can have chole, you can have fruits to your heart's content, red rice or brown rice, and quinoa upma. There are so many foods that you can enjoy from different parts of India, which actually lend themselves very nicely to eating a whole food plant-based diet. These are some of the foods that I've been enjoying. And my advice to all of you would be always think how you can bring color to your plate. By doing so, you will add fiber, and fiber is what will help to maintain your hormones. Remember that only plants have fiber, while ultra-processed foods have very little fiber, and animal foods such as dairy, chicken, eggs, and meat have zero fiber, so they don't bring health to the table. In fact, try to crowd foods of low nutrient value off your plate and add very phytonutrient rich, antioxidant rich, fiber rich plant foods that you can actually enjoy and will benefit both your palate as well as your gut and will improve your health. We have spent time talking about the importance of following a predominantly whole food plant-based diet, which is one of the 6 lifestyle pillars that is mentioned in lifestyle medicine and is particularly helpful in optimizing health and in polycystic ovary syndrome especially. The second lifestyle pillar is physical activity, and this means keeping active throughout the day. You would want to make sure that if you have a desk job or a sedentary job, try to get up and stretch every half an hour so that your blood sugars normalize and your cholesterol levels don't increase. You should try and do ideally at least an hour a day of some sort of exercise, especially in natural light. And while walking and other aerobic exercise can be helpful, strength training or resistance training is particularly helpful in PCOS to improve insulin sensitivity and hormonal balance. But do choose the exercise that you really enjoy, and that could be dancing, yoga, Pilates, going for a brisk walk, but also, again, remembering that strength training does help to improve insulin resistance, and try to bring in exercise soon after a meal, as this has been found in studies to be very beneficial, avoiding the blood sugar peak excursions. And so exercising within half an hour of a meal is particularly useful, and in women doing a fasted workout is not particularly helpful. So try to make sure that you are looking into this in some detail, and if you need the help of an expert, then do seek the advice of somebody who knows how to advise you regarding structured exercise. Referral to a sleep clinic is important, especially if you know that you have a problem with snoring or sleep apnea, where the sleeping can stop and start and can be rather dangerous. Also, if you are suffering from daytime sleepiness, then we do know that cognitive behavior therapy for insomnia, sleep clinic to address these sleep disorders, as well as consideration of referral to an eating disorder clinic if you think that you have disordered eating, and considering therapy for mental health issues such as anxiety, sexual dysfunction, and depression should all be considered sooner rather than later as appropriate, so that you can have resolution of the symptoms of PCOS that can affect the quality of your life. Try to bring in positive social connections, join clubs. If you find that your friends and family are not as supportive, then do find communities that can understand and help you, such as polycystic ovary syndrome or PCOS support groups. Avoid risky substances such as tobacco, drugs, and alcohol as they worsen polycystic ovary syndrome. Let's look at the role of supplements in polycystic ovary syndrome. I do want you to remember that you want to try and avoid multiple supplements, as many of them have not shown to be helpful and can in fact be harmful in many situations. It is much better to try and get your nutrients through a whole food plant-based way of eating rather than taking numerous supplements. But there are some supplements that have been shown to help, and so let's look a little bit into this. Vitamin D deficiency is very common in women with PCOS, and there is evidence to suggest that vitamin D supplementation, taking vitamin D 3,000 to 2,000 international units per day, especially in the winter months or if there's a lack of sunshine, after an initial blood test to measure levels, can improve reproductive function and insulin sensitivity. One of the key ingredients in a diet that emphasizes whole grains, legumes and nuts instead of refined carbohydrates is inositol. You may have heard about inositol hexaphosphate. It has been shown to improve insulin action, decrease androgen levels, and improve ovulation in those with PCOS, in both lean and those carrying excess weight. So we know that myo-inositol is safe, but there are still bigger studies that need to be done. And using myo-inositol with folic acid and D-chiro for 3 to 6 months has shown some promising results in helping women ovulate. But we don't know exactly how long one needs to be taking this, and so more studies are needed. We cannot routinely recommend it for everybody, but there may be a role in PCOS, especially as it is quite cheap and safe, and it definitely seems to improve ovulatory function and reduce testosterone and insulin levels. Based on the current evidence, omega-3 fatty acids can also be recommended for the treatment of PCOS in the presence of insulin resistance, as well as in the presence of high total cholesterol. But we don't know whether taking it for longer than 6 months actually makes a difference. So instead, do try and remember to bring in walnuts, chia seed powder, flaxseed powder, as these contain good amounts of omega-3. And although conversion rate may vary, it is useful to take this, and perhaps adding an algae-derived omega-3 supplement in PCOS at least for about 6 months. Management of PCOS is complex, and it often leads to frustration among women as symptoms may span many health disciplines, resulting in fragmented and disjointed medical advice and treatment. So nobody is really joining the dots, as one may be seeing a dermatologist for skin acne, one may be seeing a specialist for insulin resistance, a gynecologist for irregular periods, a fertility specialist for infertility, and as a result, sometimes and often, in fact, nobody's joining the dots that there is actually an underlying condition called polycystic ovary syndrome that is responsible for all these symptoms. So it is so important that you empower yourself, and if you think that you are having signs of androgen excess or irregular or missed periods, or you're carrying excess weight, suffering from anxiety, depression, or sleep disorders, please don't ignore these, because even if you don't have the condition of PCOS, you probably need help, and you need help from somebody who has both the right approach as well as a non-judgmental approach. So it is important that lifestyle prevention for preventing and managing excess weight, education, self-empowerment, and multidisciplinary care is important, that your doctors and your health professionals should be talking to each other. But treatment has to be individualized and monitored carefully. And it is important that you empower yourself so that you know the importance of managing your stress, reducing your cortisol levels, improving sleep, moving your body regularly, maintaining positive social connections, avoiding smoking, alcohol, and drugs, and following, as far as possible, a predominantly whole food plant-based way of eating. By doing this and changing your goals rather than a weight loss goal to more of a health goal, that you want to be more active, or you may want to have regular periods, or have a baby in the future, whatever the goal may be, they tend to work better than using weight loss as a goal. Addressing all the other lifestyle pillars are as important as diet, so don't ignore these, but make sure that you're actually following the right advice from the right professional. Management and treatment of PCOS has to be based on individual needs, and it should combine lifestyle and diet changes and behavioral changes. But it may be that you may need medications even though you're doing all the lifestyle changes. There is no shame in taking medications, but taking only medications without addressing lifestyle is not going to work in your favor. So it needs to be done in a sensitive way, especially as those with eating disorders may find advice regarding losing weight, even though we know it's beneficial, it can be quite triggering, even if we are recommending a plant-based diet. So do focus on the other lifestyle pillars as well, getting good sleep, regular strength exercises, and moving your body regularly, as all these will go a very long way in helping you to manage your PCOS both in the short term as well as in the long term. So in summary, focusing on all the 6 lifestyle pillars, eating a nutrient-dense, whole food plant-based diet that is rich in fiber, low in advanced glycation end products can be particularly helpful for all symptoms of polycystic ovary syndrome. The plate in the center from the PCRM team is a good guide. Aim to have 10 to 12 portions of fruit and vegetables in a day, but start with where you are and work yourself up slowly, one meal at a time, one portion at a time. A portion is about a handful or 80 grams, so try to aim for 4 or 5 different fruits in a day, as well as having a big salad and lots of vegetables alongside your dal and your beans as well. This will help to get you all your required nutrients and will allow you to bring down the inflammation that we see in polycystic ovary syndrome. I want to finish by saying it is so important to always use reliable resources rather than use the social media for your source of information, as there's a lot of misinformation out there. I've put a few resources here, including my own website that has at least 50 different fact sheets, including that on polycystic ovary syndrome. I am on social media trying to bust myths, but do look at the Indian Society of Lifestyle Medicine, the Royal College of Obs and Gynae, the American College of Lifestyle Medicine, the NICE guidelines, up to date, as well as patient support groups such as Verity and Daisy Network. So I hope that you have found the lecture useful. These are pictures from workshops that I've done all over the world, including India, to help women make informed health choices for themselves and the community they live in. I'm hoping that the book my daughter and I have worked hard on will help many with PCOS, as well as health professionals, both in India as well as all over the world. I have received so many messages from people who have found the book really helpful, but we also have fact sheets, both Rohini and I, on our website that you may find very helpful. That brings me to the end of my presentation. I hope you found it helpful. You can also find us online on social media, and we are very active trying to share reliable information.